Hello everyone, it's me again, your AI doctor. How's your day going? Let's take a moment to watch today's interesting video. I'm sure it will provide you with useful health information. Today we're going to talk about a disease that many people suffer from, one that affects millions of people around the world. That disease is diabetes. Now don't worry, this isn't going to be a boring lecture. I promise to keep it engaging and informative. I'm going to share a little secret with you. It's something personal about a friend I know. Some time ago, he seemed worried about his health, and he shared the things that made him feel unwell. He said he often felt tired, constantly thirsty, and, overall, just not himself. And you know what? He had to run to the bathroom so often that it became a real problem. At first, he thought it was just overworking or exercising too much. But maybe that wasn't the case. In fact, it was his blood sugar levels at work, and it was really affecting his life. After assessing his condition, I told him that he had diabetes and that it was affecting his body. The numbers on the meter told him the same thing. And that's also the story of many people who don't take the time to listen to their body's signals. Now, I'm here to share that knowledge with you in a way that's easy to understand and even a little fun, because learning should never be a chore. So, buckle up, grab a healthy snack, we'll talk about those later, and get ready to embark on this journey with me. And let's dive into the world of diabetes together. It's going to be an enlightening experience for all of us. Okay, first things first. What exactly is diabetes? In simple terms, diabetes is a condition where your body has trouble managing sugar, also known as glucose. Glucose is like fuel for our cells, giving us energy to go about our day. It comes from the food we eat, especially carbohydrates. Now here's where things get interesting. Our pancreas, a small organ near our stomach, produces a hormone called insulin. Think of insulin as a key that unlocks our cells, allowing glucose to enter and provide energy. With diabetes, this process gets disrupted. There are a few different types of diabetes, but the most common ones are type 1 and type 2. Each type has its own unique characteristics and requires different approaches to management. In type 1 diabetes, the body's immune system mistakenly attacks and destroys the cells in the pancreas that produce insulin. This autoimmune reaction is not fully understood, but it results in the pancreas being unable to produce insulin. This means people with type 1 diabetes don't make enough insulin and need to take insulin injections or use an insulin pump to manage their blood sugar levels. Regular monitoring of blood sugar is also crucial for these individuals. Type 2 diabetes is a bit different. In this case, the body becomes resistant to insulin, meaning the cells don't respond to insulin as well as they should. This insulin resistance is often associated with obesity and a sedentary lifestyle. The pancreas tries to compensate by producing more insulin, but eventually, it can't keep up, and blood sugar levels rise. This can lead to various complications if not managed properly. This is the most common type of diabetes, and it's often linked to lifestyle factors like diet and exercise. Making healthy lifestyle choices can significantly impact the management of type 2 diabetes. There's also a condition called prediabetes, where blood sugar levels are higher than normal, but not high enough to be diagnosed as type 2 diabetes. Prediabetes is a warning sign that should not be ignored. The good news is that prediabetes can often be reversed with lifestyle changes. By adopting a healthier diet, increasing physical activity, and maintaining a healthy weight, individuals can prevent the progression to type 2 diabetes. Early detection is crucial because it allows for timely intervention and better management of the condition. The sooner you catch it, the better your chances of avoiding complications. Keep an eye out for these common early signs. Frequent urination, especially at night. This is often one of the first symptoms people notice. This is a classic sign, as your body tries to get rid of excess sugar through urine. Excessive thirst is another red flag. When blood sugar is high, it draws water from our tissues, making us feel dehydrated and thirsty. Increased hunger is also a common symptom. Even if you're eating as usual, you might feel hungrier because your body isn't efficiently using glucose for energy. Unexplained weight loss can be alarming. This can happen because the body starts breaking down muscle and fat for fuel when it can't use glucose properly. Blurry vision is another symptom to watch for. High blood sugar can affect the lens and fluid in our eyes, leading to temporary blurred vision. This can be quite disorienting. If you experience any of these symptoms, especially if they persist, it's essential to see your doctor and get your blood sugar checked. Don't ignore these signs. Remember, early detection is key. Taking action early can help you manage diabetes more effectively and lead a healthier life. Section 5. Type 2 Diabetes Symptoms. Listen to your body. As type 2 diabetes progresses, you might notice additional symptoms, such as slow-healing sores or cuts. High blood sugar can impair circulation and weaken the immune system, making it harder for wounds to heal. Frequent infections are another sign. A weakened immune system makes you more susceptible to infections, especially of the skin, gums, bladder, or vagina. Numbness or tingling in hands or feet can be a sign of nerve damage, a common complication of diabetes. Some people develop areas of darkened skin, usually in skin folds and creases. It's important to remember that not everyone with type 2 diabetes will experience all of these symptoms. Some people may have mild symptoms or none at all, especially in the early stages. That's why regular checkups and blood sugar monitoring are so important. Section 6. Managing diabetes, treatment options. The good news is that diabetes, especially type 2, can be effectively managed with the right approach. Treatment typically involves a combination of lifestyle modifications and medication. Depending on the type and severity of diabetes, your doctor might prescribe medications to help your body use insulin more effectively, or to stimulate the pancreas to produce more insulin. People with type 1 diabetes, and some with type 2, require insulin therapy to regulate their blood sugar levels. This can be administered through injections or an insulin pump. Remember, it's crucial to follow your doctor's recommendations and never adjust your medication or insulin dosage without their guidance. Section 7. The diabetes-friendly plate. Food is medicine. Now let's talk about everyone's favorite topic, food. The food we eat plays a vital role in managing diabetes. The key is to choose foods that help regulate blood sugar levels and provide essential nutrients without causing drastic spikes or crashes. Opt for whole grains, fruits, vegetables, and legumes, which are digested more slowly and provide sustained energy. Protein helps stabilize blood sugar levels and keeps you feeling full and satisfied. Good sources include fish, chicken, beans, lentils, and tofu. Unsaturated fats, found in avocados, nuts, seeds, and olive oil, are beneficial for heart health and can improve insulin sensitivity. These unhealthy fats, found in processed foods, fatty meats, and full-fat dairy products, can worsen insulin resistance and increase the risk of heart disease. Remember, portion control is also crucial. Even healthy foods can raise blood sugar levels if eaten in excess. Section 8. The Power Trio Diet, Rest, and Exercise. Managing diabetes goes beyond just medication and diet. It's about adopting a holistic approach that includes regular physical activity and adequate rest. Regular exercise helps improve insulin sensitivity, lowers blood sugar levels, and reduces the risk of heart disease. Aim for at least 30 minutes of moderate intensity exercise most days of the week. When we don't get enough sleep, our bodies produce more of the stress hormone cortisol, which can lead to insulin resistance and weight gain. Aim for 7 to 8 hours of quality sleep each night. Remember, consistency is key. Making gradual, sustainable changes to your diet, exercise routine, and sleep habits can have a significant impact on your overall health and well-being. Section 9. Your health journey. Take charge and thrive. Well, there you have it. We've covered a lot of ground today, from understanding what diabetes is to exploring ways to manage it effectively. Remember, knowledge is power, and by arming yourself with information, you can take charge of your health and live a full and vibrant life. If you have any questions or concerns about diabetes, don't hesitate to reach out to your healthcare provider. They're your best resource for personalized advice and support. And hey, feel free to share your thoughts, experiences, or even your favorite healthy recipes in the comments below. Let's support each other on this journey towards better health. And now, goodbye and see you in the next videos. Remember, I'm Dr. AI, facts so tight, always right.